Welcome back. The Indian Council for Medical Research has detected 2 cases of the human metapneumovirus or the HMPV in Karnataka. And this happened while there were routine surveillance happening. Now, the ICMR has also saying that and has given an assurance that the surveillance systems are robust and there is still no unusual surge in these cases in the country just for now. The details of the detective HMP cases are as below. The first case that was detected in Bengaluru was in a 3-month-old female infant. She was diagnosed with HMPV after being admitted in a hospital in Bengaluru with a history of bronchopneumonia. The baby, in fact, has been discharged after receiving treatment. The second case was an 8-month-old male infant who tested positive for HMPV on the 3rd of January this year after the child was admitted to the same hospital in Bengaluru with a history of bronchopneumonia. The infant is presently recovering. So these are the details of the 2 cases that have been detected, and this did raise some concern amid the outbreak in China. But the health ministry has said that there is no unusual surge of this virus, and India is closely monitoring the situation. As far as HMPV is concerned, there has been many cases of the infection in India, and the Indian government and the Union Health Ministry also giving an assurance that there is absolutely nothing to panic. There is no serious concern. There is no surge in HMPV cases just as yet, and that Indian government is very well equipped to handle the situation. Let me go straight across now to Sharon for more on this. Sharon, so words of reassurance coming in from the Union Health Ministry. 2 cases have already been detected. It did, spark some concern given the outbreak in China. But what's the latest that you're hearing from the Union Health Ministry and the central government?
Well, the Union Health Ministry maintains that as far as the HMPV cases are concerned, we are well equipped to handle the situation. And as far as the cases of HMPV infection, infection is concerned, it is not the first time that India will be facing the infection. It has been in the country for years altogether. So we are well aware of the symptoms, how to handle the situation. But of course, if the infection spreads and it is not possible to contain, then it will become a burden on the health facility. So to avoid any sort of such vast infection spread is what right now Health Ministry is monitoring the entire situation. They are in touch with all the states and the UTs. We have asked all the state and UTs that whenever they are getting any influenza-like illness or severe acute respiratory illnesses, those cases need to be reported. There is a ministry dashboard called IHPI. So all the cases need to be uploaded there by each of the states and the UTs. And there are also precautions that has advisory that has been sent to all the states to ensure that they are implemented on ground, like isolating the person who is infected with ILI or SARI infections. And apart from that, any case that is in fact turning positive of HMPV, that also needs to be informed to the Union Ministry, and accordingly the precautionary measures needs to be taken.
Interesting. Sharon, thank you so much. So can the HMPV virus in China actually trigger a health concern in India? Well, in an interview with News18, Rajiv Jayadevan, who's the chairman of the Kerala State IMA Research Cell, has said that HMPV is actually very common in young children and that there is no vaccine or antiviral treatment that is recommended. In fact, the expert noted that for most people, HMPV will cause mild symptoms. We have right now the reaction of the
Government of India, and I'm having a meeting at 12:30 to see whether any other new information has come and for any further steps we have to take.
So why is there no clear communication yet from the center?
That's now being started? Is there going to be testing that's going to be started?
No, that I don't know, Zila. No, let us not take any decision before coming to a proper conclusion. I mean, of course, the PCR testing is always there for this. But whether that is needed or not is something we have to look at. Whether it is causing any serious, is it a serious public health concern? That has to be first of all decided. Is it really a public health concern? Just because one case has been detected, there are if you test anybody with some cold, they'll have some virus in them. If you test, I've got a slight cough right now, so I'll be having something. So that is another issue. But is it a public health concern or not? That is something we have to take a decision. Based upon that, then we can take further decisions.
Sir, why is there no clear communication from the center with
I
regards to the
think-
testing in NIV Pune?
I don't think we should be simply testing when, unnecessary. How many, for every person with cold and cough, if you start testing, then, what is the use of all
To
that?
find out the strain of this.
But this is our own, these are all local strains which have been there. Whether China, we should also first know what is the strain that is there in China. That information has to come. So whether do they have it or not, I do not know. So let us see. I think maybe I can give you more clarity after the meeting gets over. And I will not want to blame anybody. But of course, we all have to be careful and take whatever necessary, which is there for all, any viral or any bacterial diseases. If we are careful, it's better for us to wash our hands, to maintain some distance, especially if you have got symptoms. Those things are already advisories have been issued.
Sir, as you said, this is not the first in India, but what about Karnataka? Is this the first case that came to
I
your
will not
office,
say
or-
this is the first case in Karnataka because it has been there for the longest time. Certain percentage of people have this. Every time if you go into a detailed testing, in Baptist hospital, they've tested it and they've private hospital. So we can't call it a first case at all anywhere in the country because it is already there. This may have been, they may have tested for this particular thing and it's been detected, that's all. But it's not that it's the first case.
So one of your Congress MLAs, Mr. Raghavendra Hitnal, has made a statement today that there isn't enough money for development because of the guarantees. This isn't something
I do not know in what context he said because first of all, people from that region are getting the maximum funds. Kalyan Karnataka region, especially compared to other
We go straight across now to Harish for the latest. We just heard from the Health Minister of Karnataka, Dinesh Kundu Rao. And Harish, the minister clearly has been, updated by the doctors, and he was very measured with his words, trying to allay all fears and concerns, not trying to cause any panic. There hasn't been any surge of cases. 2 cases have been detected in Karnataka. So what's next for the state government?
Well, right now they would have a round of meeting with the health officials and experts to understand if Karnataka should start treating this as a virus of concern and then ask all the labs and hospitals to go in for testing wherever there is acute respiratory influenza or such cases. And at the same time, as the minister is saying, there needs to be a decision taken on whether this should be treated as a public health concern or any other seasonal flu that perhaps is around. Because right now, as the minister is saying, there perhaps is not much information on the strain that's causing a spike in number of cases in China. Only if that is available, then states and the entire health setup in the country can decide if the virus that's in Karnataka, in Bangalore, is the same, and if there needs to be heightened sense of testing and random testing. That's something that can be done. But right now, as Dinesh Kundu Rao is saying, that information is not available. So right now, they'll have to understand if they should start going in for more number of tests, what's the kind of measure or at least information and diktat that needs to go in from the state government and the health department to various labs and the hospitals in the state.